Discussing echocardiograms is Heart Center cardiologist Dr. David Weinreich. Dr. Weinreich, why might you order an echocardiogram for a patient?
Echocardiograms are a form of ultrasound which are very commonly used to image the heart. They've been around for about 30 years now, and they're commonly used to give information about the heart's pump function, about the valves, and about the possibility of fluid around the heart. Doctors commonly use them to assist and to aid in what they found in doing a physical exam. So the simple stethoscope still has value, but the echo can add tremendous information to what is heard by the doctor on an examination. The test is painless, it can be performed at the bedside, and the results are immediately available. There's no injection or insertion into a large machine that is involved. The test is so safe that, as you know, many women have echoes or ultrasound during pregnancy to look at the baby. So therefore, we think it's a very safe study to be done. Also, the information that's gained can be very important in looking at patients who come in with a variety of complaints, such as chest pain, shortness of breath, dizziness, fainting spells, and so forth.
Why might a patient need follow-up echocardiograms over a period of time?
We commonly do order repeat echocardiogram studies. Some of the common reasons for doing this would be to follow heart muscle function and heart pump function. That's a very important determinant of how long people survive, and we can use it to assess when the heart pump is declining and to indicate whether they need more sophisticated procedures performed, such as defibrillators and different types of devices. This information sometimes is very hard to obtain just by doing a physical exam, and echo is really uniquely suited for that purpose. Another important area where echoes are used is to look at heart valves. Heart valves can, in simple terms, be said to be either too clogged or too leaky. And for either purpose, an echo can be very useful to give very accurate information as to whether the valve is working well. Previously, we had to do invasive studies in the cardiac catheterization lab to follow these kind of valve problems, and now this can be simply performed without the injection of any dye. The studies correlate very highly also with what we find in the cath lab, so they can be a very accurate guide for the surgeons. Some patients also, for another example, have fluid accumulations around the heart. If the fluid accumulation is small, then usually nothing is done. But sometimes these fluid accumulations can increase. And following the size of that fluid accumulation, or what we call pericardial effusion, can be very valuable. And echo is a very simple and quick way to make that determination.